Hello everyone, so welcome back, and today we're going to talk about the planning station of the midwifery Osce. So if you look at my previous video, we did have an in-depth step-by-step process of how to go about the assessment station. So stay tuned, and this is going to be really fun. So the planning station of the midwifery Osce is the second station out of the 10 stations. So we have 10 stations with the new exams for the Osce, and planning station is the second one. So the planning station is 15 minutes. You will be using a different pen. Now, if you are to be given a blue pen for the assessment station, you are going to be given a different pen, either a black pen or a green pen for the planning station. This is one of the reasons. Is because you will be giving back your criteria, all the notes, all the paperwork you were given in your assessment station for the planning station. And that information where you arrive from your assessment is what you'll be using for your planning station. So they do not take it away from you. You will still be giving back all those documents to be used for your planning station. But just to make things fair, they're just going to give you different pens, so you wouldn't have to use the same pen to make corrections of the previous work you did in your. The planning station is a silent station. Silent station means that you wouldn't have to do any practicals, or you wouldn't have to stand in front of the examiner to perform whatsoever. You'll be given a chair and a table with your previous work done on it and a new sheet. Now this is going to be a plain sheet with nothing written on it. What you have to do is you write your full name, you write your date, and you sign. If you do not write these, you are going to fail, irrespective of whatever you have done in your planning station. Your planning station is considered a care plan, but a care plan needs to be written in a form of an Sbar. And what do we mean by Sbar? Sbar is an acronym where S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. So that is a way of planning care. Why would you say that the previous work you did in your assessment station will be given to you back in your planning station? Now, here are the reasons. 4 stations out of the total 10 stations are link station. When we say link station, it means that the same situation of a patient, for example, if you are giving a patient with vaginal bleed at 10, that same scenario is what you will use for your assessment, and you'll be using the same thing for your planning station. And that same scenario is what you'll be using for the test station, which is the implementation station, and the evaluation station. So 4 stations are linked together. They have the same storyline of the same patient, where you assess the patient, you plan care for the patient, you implement your care, then you evaluate. So the first 4 stations, usually people call it API. So the scenario that was given to you in your assessment station, where you used to plan your assessment, if you don't forget, as I said, your assessment consists of your practicals, filling your meals chart, and doing a handover to the examiner in order for you to pass. Once you've completed all these stations out of 20 minutes, you'll be given a full set of 15 minutes to do your planning station. Your meals chart will be given back to you, the scenario will be given back to you, your rough work will be given back to you, and a new sheet where you'll be using for your planning station will be added as well. A new scenario of your planning station will also be added as well. Someone will say, why new scenario? Okay, you'll be given a whole overview for the assessment station. Now you need a bit more information to talk about your planning station. So they will tell you that plan care for this patient, and they will add just additional information to it to help you. They are not going to trick you whatsoever, but they need to give you additional information where you can use to plan care for your patient. People will say, okay, care plan, you do plan of care, you do implementation, outcome. No, this is in the form of an Sbar. And we're going to talk about the situation separately, background separately, assessment separately, and also recommendation and what needs to go in each point. Situation. So with the situation aspect of your planning station, you are supposed to talk about the current situation that the patient is coming with. Why, if let's say you are reporting something to someone, why are you saying that this, and why did the person come in? So the situation does not talk about any history whatsoever. It just talks about you introducing yourself as the staff or the midwife, introducing the patient, and what the patient is coming with. So there are three things that you need to put in your situation station. So that is your introduction, the patient introduction, and the present complaint of the patient. Considering the situation, how are you going to introduce yourself and introduce the patient, as well as write the presenting complaint? If you did your assessment station, realize that most of them were practical, you just had to verbalize everything. But here lies the case, you are actually writing it. So how are you going to put everything into writing? This is how I usually put it. I am Anita, the midwife taking care of the patient, Juliana Mensah, hospital number F03999, date of birth 15 June 1994, who presented with vaginal bleed and lower abdominal pain. Full stop. You are done with your situation. It's that simple. Don't add anything further. Don't add anything more. Your introduction, you introduce the patient, and as I said, introduction of the patient is three things: patient's full name, patient's hospital number, and patient's date of birth. You write those, even if it has been written somewhere on your sheet, forget it. Assume nothing is written. Repeat that same thing in your situation, because they are going to mark your situation and they are not going to mark your paper and whatever is written in your paper. So always write, my name is Anita, the midwife taking care of, or midwife caring for, Juliana Mensah, hospital number F03999, date of birth 15 June 1994, who presented with lower abdominal pain and vaginal bleeding. Full stop. Isn't it? So we talk about the background. Now with the background, this is the lengthiest of the planning station, because you're going to talk about all the history of your patient, and usually you can find your history in the scenarios, in the scenario given to you when you had your assessment done. So you see, you were given an overview. You'll be given an overview. It's not like we're given an overview. You'll be given an overview where you have to now review all those history with your patient if you did the practical station. So you review all those history. Now you are going to put all those history back into writing. So it's more like repeating what they have given to you in the assessment scenario back for them. And this is what takes time, because if the patient have got a lot of history in the scenario, you have to write as quick as possible, and all those needs to make sense. Now, what do we consider when you are writing a background? The background needs to talk about the gestation, the past obstetric history, present obstetric history, present medical history, past medical history, social history, medication history, allergies, and the thing you ever don't need to forget is differential diagnosis. If you don't write your differential diagnosis in your Sbar, it's a total fail. Always write your differential diagnosis in the background. Let me give you an example of how I will present a background. I will say that my patient is gravida 2 para 1 and is 39 weeks pregnant, or 39 weeks gestation. She presented with, and I repeat whatever I wrote in my situation. So she presented with abdominal pain and vaginal bleed, where she said which started at 9 o'clock on 26 October 2022. The funny thing is that usually they tend to add more time, or they make it more precise when exactly the client was feeling all those things in the planning station. So they give you additional information, as I said earlier on, and that can be the time the patient had those pain or the time the patient saw the vaginal bleed. So when you are writing your background, you need to repeat the presenting complaint, but add the specific time all these happened, only if it was included in the scenario. So any additional information that has been added to the present complaint in the assessment station needs to be written in your background. Now it becomes a history. So the background is more like a history, anything you have done. Do you understand now? So like I said, you present, and I just give an intro of how you present to patients. So my patient Juliana is 39 weeks, gravida 2/1, and presented with lower abdominal pain, which started on 29 October 2022, and vaginal bleed, which started at dawn today at this time. So usually in the station they do say today. When you have the scenario, they have something like today. When you see today, it means today's date. So you're not supposed to write today. You're actually supposed to indicate the time. So today into bracket. What is today's date? If today's date is 7th November, today, 7th November 2022, it's best to save yourself rather than not writing it at all. Write every history and also add your differential diagnosis. So the differential diagnosis where you generated from your assessment station now has to be included in the background. Let's talk about the assessment aspect. Someone will ask me, I did the assessment station, I documented, I reviewed mother's history, I did abdominal palpation, I did my urinalysis, all those things. But at the end of the day, I only filled a Meows chart, and the Meows chart doesn't have much knowledge or much in-depth of what you did in your assessment stage. So what am I going to do with the rest of information I generated? This is where you inculcate everything in your assessment station. So your assessment station is now going to talk about all those information you gathered in your assessment station. We talked about your maternal observation, so you're going to repeat the maternal observation. You are going to talk about the abdominal palpation you did, the lie, because in all the abdominal palpation, you are not going to write it in your Meows chart. So this is where you inculcate it in your planning station. So your planning station has an assessment. So all those assessments you did in the assessment station now has to be written in the assessment aspect of the Sbar. And if you remember, what did we do in our assessment station? We did talk about the maternal observation where we performed it. So all the results you had for your maternal observation, mom's pain score. Then you have to talk about abdominal palpation, all those things you did with your abdominal palpation, the FH, the contractions, the lie, the presentation, the descent, anything you found, the visual observation, if mom had a scar on the abdomen, all those things now has to be written in the assessment station. Sorry, in the assessment aspect of the planning station. Then you talk about the urinalysis you did, the findings you had. Then you also talk about the vaginal loss, if mom had a vaginal loss, if mom didn't have a vaginal loss. If mom had a vaginal loss, what are you saying? Now you cannot say that mom didn't have a vaginal loss when in that scenario you've been given, it is clearly stating that there is a PV loss. So if there is a PV loss, then you need to indicate what mom is losing. That is what goes into your planning station. In your planning station, the assessment aspect, never forget your pain score. If you forget your pain score, you are going to be marked down and you can fail in your planning station. Every information is important because they consider it that if you do not add it, the likelihood of you putting your patient at risk is high. So they are not marking you down because they are going to be cruel to you. You are supposed to report something to an MDT, a multidisciplinary team, where you do not include pain. So I say that mom is not in pain. That means that if mom is in pain and you did not write it in your assessment station, mom may not be able to be prescribed with analgesics to have. So it's like they have to mark you down for you to know that you are putting your patient at risk. So it's super simple, but all the information needs to be in order. There needs to be a coherence, and that is where the Sbar came into play. Someone will wonder, what am I going to write for my recommendation aspect? A lot of things goes into recommendation, because this is where all those knowledge you have needs to be inculcated in your recommendation. Recommendation is about your brain. Whatever you develop is what you're going to write. At the same time, it can be marked down, because if you write foolish stuff, or if you write stupid stuff, or things way out of the ordinary, nothing relating to your situation, then you are going to fail in your planning station. So what goes into your planning station? That is the recommendation aspect. With the recommendation aspect, I always say that I have found the easiest way to gather recommendation, and this is what we're going to do. What should I write in my recommendation? Let's go back to our meals chart. As I mentioned earlier on, our meals chart, the back of the meals chart has some planning or some plans, some plans on the back of the meals chart. That I always say that you need to read it out to your examiner during the assessment station. Those things, if you have got nothing to write, even if you've got nothing to write, nothing in your brain, you are so nervous, not that aspect, just repeat whatever is written there, because that is what you said you were going to do for your mother in the assessment station. When you had your score of the meals chart, probably you had 2 yellows in your meals chart, and you said that you told the examiner, okay, examiner, I had 2 zeros in my meals chart, therefore I'll be doing this, that for my patient. Now here comes the planning stage. You are supposed to write their plan of care. That means you need to include all those things you did mention to your examiner in your planning stage. So what you do is that the very first thing, if you've got nothing in your brain, just go back to your meals chart. At the back of your meals chart, repeat all those points for your recommendation, and you give either 2 or 3 differential diagnoses. If you give a UTI diagnosis, what are you going to recommend for a UTI? You need to send MSU, right, for cultures. You need to also do a PCR. If you mention that your mom has raised blood pressure, you need to send a PCR. And you need to monitor mom's blood pressure frequently, or do a BP profile. You also probably might have mentioned is early labor. If you are doing early labor, what are you supposed to do? You are supposed to check fetal heart rate every 15 minutes. As I said, in labor, you are supposed to check every 15 minutes when you are in labor. Or what are you supposed to do when mom is in labor? You need to manually palpate mom's contractions for complete 10 minutes to know mom's contraction in every 10 minutes. Finish. You are done with your recommendation. How simple is this? So don't always think like, oh, what am I going to write in my recommendation? What am I going to write? I have nothing in my head. Don't worry. Your differential diagnosis, just think about it. I have 2 differential diagnoses. If I'm saying that my patient is in early labor, what will you do for a patient in early labor? Write all those things. If my patient is having UTI, in my differential diagnosis, what are you going to do for a patient with UTI? You are supposed to take urine sample for labs and all those kind of stuff. If I said my patient is eclamptic, what am I going to do for an eclamptic patient? If I said my patient is diabetic, what am I going to do for a diabetic patient? You need to check mom's blood sugar every hour if she's in labor. Or if mom is taking insulin, you need to check all those things in variable doses. Isn't it? So just repeat all those things. Then repeat the things at the back of the meal chart where you recited to your examiner. Just write it. You've recited it, now it's back for you to put it into paper. So repeat all those things in your meal chart, and in your station, your recommendation aspect of your planning station. So a recap, and this is a brief aspect of the planning station. We are done with the planning station. And what did I say? Planning station gives you have 15 minutes for your planning station. You are given a different pen color to be used to write whatever you need in your planning station. If you used a black pen to fill your meal chart, you will be used a green pen, or you will be given a different kind of pen color to do your planning station, just to show fairness and to prevent people who might want to cheat in the examination. What again? All documents that was used in your assessment station is given back to you for you to reference from for your planning station. and your planning station needs to be categorized in an Sbar. You are given a blank sheet. Make sure you write your name, today's date, and sign against it, as you can fail. Your blank sheet has to be put in an Sbar form. So you write situation, then you write your situation. What goes into situation? Your full name, who you are, introducing the patient, then introducing the present complaint. These 3 points is what goes into the situation. What goes into the background is mom's history, past medical history, past obstetric history, presenting complaint with the precise time all those present complaint did happen, medication history, social history, allergies, and your differential diagnosis. This is what goes into your background. What goes into your assessment? Assessment is a repetition of all the points you gathered in your rough work when you did your assessment station. It's what has to be written in your assessment aspect of the Sbar. So the assessment aspect is a repetition of what you did in your assessment station, be it a now written aspect of it. What goes into your recommendation? Recommendation is you writing all those things you verbalized due to your examiner in the assessment station back into your recommendation, and giving planning for care for all those differential diagnoses you gave. So if your differential diagnosis is UTI, what is the thing that you want to do for a person with UTI? You write all those things. And now, not forgetting saying that you administer prescribed medication at the right time. I hope you've all understood how the Sbar goes about. It's very simple, but it can be really tricky if no one has actually showed you what goes into the whole situation. So thank you, and I hope you enjoyed the planning station. In the next video, we will talk about the implementation. I will also give a separate video where I talk about the meow chart, how to fill the meow chart. And I hope you've enjoyed everything. See you and thank you.